Hey everybody, it's Dr. Yola. Instead of an update, I'm pushing out a plea for you to stay home. We as doctors, nurses, other healthcare professionals serve patients every single day in the midst of this pandemic, taking care of those who are most adversely affected by COVID-19. I put myself at risk. I fit in the high risk category. I have asthma. But even more importantly, I put my daughter at risk at 7. I put my mother at risk, knowing that she's over 60 and has a chronic disease every single time I step out of that door to help take care of patients. But I'm willing to do it because that's my calling. All we are asking the thousands and thousands of doctors and nurses and other healthcare professionals, everyone working in healthcare, all we're asking you to do is to stay home. We're out saving lives, putting forth the sacrifice. And all we're asking you to do is to stay home in the way that our government officials and our public health officials have asked you to. It doesn't matter what your risk is. We are all at risk. And again, this isn't a waving the flag to panic. It's just to pay attention. It's to do the right thing. There is no high risk group. We are all at risk because when you go out and don't pay attention to social distancing and all these other things, you put every one of us who are in the high risk category at risk. And don't let the statistics fool you from Wuhan, China. Here in the United States, almost 40% of individuals who have been hospitalized here in the country since the start of the pandemic here, almost 40% have been between the ages of 20 and 54. And those in the ICU, half of them have been less than 60. So although we've been pushing out these high-risk groups, everyone is at risk. And in order for you to protect everyone else, you need to do the right thing. My colleagues are seeing patients without protective equipment. They're risking literally their lives in order to save yours. The least you can do is stay home.